State and federal politicians are taking aim at diversity, equity, and inclusion in public schools. Indiana Senate Bill 289 would remove some DEI training and programs in Indiana if it's passed. Higher education reporter Aubrey Wright has more on how medical schools inspired the bill.
The bill's author says Indiana's medical school applications process inspired it and his demands for equal treatment for all students. But medical experts and students say DEI levels the playing field as schools lack diversity. In between her work at the hospital and classes, Indiana University medical student Olin Menez is speaking out in support of DEI.
It's hard because we say DEI, but we need to understand what that means, and it's diversity, equity, and inclusion, right? There is no part of this that's meant to exclude anybody. It's in the name.
She's a member of the DEI Coalition, a student group, and to Menez, DEI means getting the best out of everybody. It means doctors have a better education and patients receive better care. But she says the proposed bill could jeopardize that.
There's a lot in this bill that's worrying, but definitely having the government so involved in our curriculum and what we're teaching worries me a lot.
Parts of SB 289 come from Senator Tyler Johnson's experience as a doctor and as a mentor to a student applying to med school. He didn't respond to multiple interview requests, but addressed the Senate in February.
He felt discriminated against, which obviously he was during this process, going through the medical school admissions process at a university here in Indiana.
He says the student believed he had to conform to a certain ideology, and some medical faculty supported the bill.
I've had multiple fellow faculty members here to testify in front of committee.
Doctors, students, and medical associations are pushing back on calls to remove DEI values from medical education.
DEI, by definition, levels a playing field.
Good Trouble Indiana is a grassroots advocacy group focused on healthcare.
Are medical schools diverse today? Do you think
No.
that they should be doing more?
Well, for many, many years, they haven't been diverse.
Walsh says Black, Latino, and Indigenous people are underrepresented in medicine, and that hasn't changed in years. After affirmative action and race-conscious admissions were banned in 2023, medical schools such as IU's saw dramatic drops in diversity. Menez says critics of DEI should shift their focus to removing financial and class barriers to medical school.
We're not trying to make sure a certain group doesn't get into medical school. Medical school admissions are getting harder.
Walsh says improving patient care is the most important reason for diversifying medicine.
Care delivery is different. Seeing doctors and the healthcare team who look like us really matters, and this science bears this out.
Menez agrees that there should be a diverse doctor workforce.
We need men to be treating men who don't feel comfortable with a woman examining them. We need women to examine people who have been assaulted, and they just don't feel safe around certain types of people. We need people who speak Spanish. We need people who speak French.
Menez wants to work in pediatrics after she graduates. She says having each part of her identity shine and help patients has made the tough times worth it.
It has been good to kind of bring everything together and put it into patient care, get to where we are now. It feels good.
SB 289 passed the Senate and advanced to the House of Representatives. The U.S. Department of Education is also pressing schools to get rid of DEI programs and scholarships. For Indiana News Desk, I'm Aubrey Wright.